Thanks for the opportunity to be here. My background, I'm a family physician. I'm a geriatrician. I actually came out of medical education. I taught in family medicine residency, and I was the director of a geriatric medicine fellowship, where I had many wonderful trainees, including the fabulous Wellesley Chapman, through the years. I'm here in Seattle, and I started the Iora Primary Care Clinic just down the street in the Central District in Seattle in 2014. The clinics that we started here in Seattle, in Washington, and also at the same time in Arizona and now in Colorado are exclusively for Medicare patients. So our model has evolved a bit from the one that the previous speaker mentioned, and we're now also caring for people Medicare. My clinic is 100% Medicare patients. So just to tell you a couple things about the Iora model, that basically we are promoting the same sorts of values, relationship-centered care. We really believe that relationships between the physician and the patient, and frankly, between the care, among the care team and between the care team and the patient, has to be at the center. Technology will not save you. Relationships have to be at the center. We also believe in value-based payment model. We believe if the payment model is, if you're buying the wrong stuff, you're going to get the wrong stuff. So we, all of our clinics are 0% fee-for-service. We're fully capitated. We believe in the robust care team. So I do think that some of the answers to how are we going to serve our population, either what I think about in my poor, underserved, ethnically diverse population that I serve in the Central District here, or in any country in the world, is you have to have a care team. And in medicine, we've made a lot of errors, I think, through the years in thinking that the way to build a care team was to think about what titles you needed and what particular training you needed for each person, and then try to fit people into those slots. We hire people for their empathy and for their communication skills, and we train them to do what they need to do. They are essentially community health workers, and they become medical assistants, et cetera. And I think that's a very, very powerful part of the model. We also have really written in from the outset that we are going to create an outstanding patient experience. Our customer, our client, our member, we've heard a lot of language around that today. You know, this is Walt. Walt takes the bus up from Tacoma to come to our clinic. This is one of our nurses, Lindsay. His favorite thing to come for is Beatles sing-along, which we had in the third week of last month. And, you know, so that really giving a wonderful patient experience isn't just about answering the phone quickly, right? It's about building experiences that make the care better, that are really oriented towards people who need them. So this is, you know, we all have our own pictures, but they all have the same words, basically relationships between the teams, the patients, the providers, the payers. We think all of those have to work together, but again, we really emphasize the centrality of the relationships. You know, we're looking for the same results, which are the quadruple aim, basically, by which I say, you know, better care, lower cost, good patient experience, improved behaviors. But it also has to include the fourth aim, which is the experience of the care team. So we can't balance this on the back of overworked doctors and healthcare providers. The way we've built our care teams, sorry, the yellow is a bit hard to see, but the patient and family jumps right out at you, as in fact it should, right? So, but sort of surrounding the patient and the family, and by the way, because I'm a geriatrician, I never ever think about the patient outside of their environment, their community, whatever that is for them, their caregiving unit. We err all the time in medicine by just thinking about, you know, the patient, and we build these textbook perfect plans that are never going to work. So we have to surround the patient caregiving unit with a doctor, does doctor stuff, nurse does nurse stuff. We also have health coaches. That's sort of what we use as our sort of community health workers. They are hired from the community. They don't have to have any background in healthcare, though sometimes they do. We train them to be medical assistants, and they do the work of MAs, which is in American healthcare. They take vitals. But then their really central job is to build relationships and promote health. So they are the engine of our self-management support for our patients. We have integrated behavioral health with licensed social workers. Okay, and then again, patients at the center, really thinking about strongly about how to build self-management skills in patients, which has been really the only thing that changes outcomes in chronic diseases, which with an aging population is what we are dealing with. You have to support and empower the patient to take care of themselves. So to do that, we have to remove barriers to access. We use a lot of groups and classes so they can have fun and sing and dance and do all that stuff that they like. This is my clinic. We had our 2-year anniversary party, and a bunch of people from the neighborhood showed up. That's just another day. It was really fun. We've gotten a fair bit of attention for this in the media. All I'll say is, like, I hope that it works out like some of the press has thought. I'm going to be honest, we're still early days. We're a startup, and that's how it feels most days. I have a short video that I was asked to show just to try to, again, sort of let you hear from a little more words from our patients. I describe IORA as a way to provide really comprehensive, wrap-around, high-quality, evidence-based primary care using a team model that's much more robust than the model that we have in other places.
The defining thing about care for seniors is that they have a big burden of chronic problems. And when people have chronic problems, that person is crucial on the healthcare team.
Okay, relax like you're on vacation. Take a deep breath.
Well, the first thing that surprised me when I came to IORA was that it was relaxed. Nobody expressed anxiety. Nobody was looking at their watch, and that was an amazing experience. It was totally different.
Our main goal is to make sure that we can give our patients the best quality care that we can and empower them to be the best that they can be so that their life is also fulfilled. And it's not just that face-to-face that's most important, it's what happens when they leave here. Building that relationship is valuable because we do have to have trust in order to fully help our patients where they need that help most.
They have to know what to do to take care of themselves. They have to have the confidence that they can do those things, and they have to know the game plan. So what's different here is we actually have the time to do it. We go slow, and we have a set of values that really cherishes their role in collaboration. And it's working because of it.
The greatest benefit in IORA, I'm sure, is their ability to communicate with a team. And they have the coach who does the preliminary, and then the doctor comes in, and IORA and my heart doctor pass information back and forth, which is a great benefit to a patient to know that you have two doctors in sync.
We don't just do passive healthcare, we don't just see you and then send you out into the world. We're invested in our patients' care, and we're very concerned about ensuring that our patients have the best quality life, and that's the goal. We're giving them the tools to achieve that.
We have to remember that we are talking a different talk. We're bringing a new language to the conversation of healthcare, and we're not just talking about it, we're doing it. We're walking the walk too.
IORA sets an expectation that really should be met by all healthcare companies, but that's what's necessary for people's care and for people to feel cared about. What I like best about my role is working with patients. You're constantly surprised, and you just learn so much from the process. So I go home every day having learned something myself and feeling like I've made a difference.
We were looking for something special, and we feel that we found it in IORA.
Basically, the IORA, the people are friendly and they care about your health. I feel that it's important to see somebody who cares about you.